Chicago, did his residency at Children's Mercy Hospital, and he is double board certified in geriatric medicine and internal medicine. So let's welcome him up.
Thank you for having me. I was at you guys at stage 45 years ago, and the one thing that hasn't changed is just how many people you can actually get to come to something if you offer free pizza. Pizza's pretty good, actually. All right, so I was informed that this is supposed to be relatively informal. That's fine by me. And I guess he says something about coming to career day and talking about being a doctor. So, I guess the commonest question I always get when I do one of these kinds of things is, why did you want to be a doctor? Hell, I don't know. I came out of a little different era than you guys, okay? Obviously, we had no cell phones, okay? No internet, no those kind of things. We did have television. It was black and white. Okay, two-color television, black and white. And I guess when I was a kid, one of the things that always fascinated me was medical shows on TV and stuff. And you're going to have to look this one up. You'll probably have to Google this one while I'm talking. But we had things like Dr. Kildare, Ben Casey, Emergency, Marcus Welby. That came around a little later. I was already a little older. But there were always shows that really, I mean, medicine was it, okay? Medicine was like the mecca of careers when I was a boy. I can remember my grandfather, God rest his soul, he lived to be 88 years old, and he worked for General Motors. He was a tool and die man, and we lived on a farm. I grew up farming and stuff. I threw many more hay bales than there are fingers and toes in this room, I assure you. But he used to idolize medicine, and he used to do this. I still see it. It still cracks me up. And say, you just hang that shingle, boy. Just hang that shingle. That's all you got to do. Because it was like the job. You know, it was the best thing. It had money. It had prestige. It had, you know, you were. I mean, I can remember my mom worked for the local doctor. Okay, in town home where I grew up. I grew up in a small town like this. I've been going in the back door of a doctor's office since I was old enough to walk. And the only thing I can tell you about the waiting rooms that where my mom banished me to if I got in trouble while I was in the office. And so I was always horsing around there after school, going home with her and stuff. But those doctors, I mean, this is going to sound arrogant, I don't mean it to be, but they were God. And I'm not kidding you. They would tell you to do something. I watched this more than one time. I actually saw the doctor grab somebody by the scruff of the neck and throw them out of the office because he didn't do what he was told. It was different. It was a different era. He just didn't it. But anyway, so I grew up with all that and stuff, and I just thought medicine was like going to be just the coolest thing in the world and stuff. So we got you be on television. You got all these great shows. You got to save people's lives. You know, but I don't think you really know about a career until you actually get into it. And I don't care what it is. Okay, if you want to be a teacher, you're not going to know what it's like to even teach it for a year or two. Student teaching, okay, that's a little bit. But once you get a year or two under your belt, you're going to do it. An accountant, it doesn't matter. Same thing applies, I think, in all fields. You really don't get it until you're there and you try it for a little while. I do think it is a good idea if you can get internships in something, or if you can, you know, be involved in or follow or shadow, or what they call it, or whatever. I think those are great things to do because you can get an idea of what's happening in a given field. And I think the one thing you can sometimes tell is what you don't want to do. I mean, there were some jobs I could tell you I did not want to do. Okay. And throwing hay bales all day was one of them. All right. So, a guy came to the farm one time. This is a true story. He looks at the thing. He looks at his one of our hay fields, and what it was alfalfa. And what he wanted to know was what kind of hay it was. But he asked the following question. He goes, "What do you call that?" And my grandfather started to answer the question. And I was in the middle of college. And I said, "I call it motivation." And my grandfather started laughing. And I think if you grow up working like that and stuff, and we did, we were like dogs. I mean, we worked very hard, but it pushes you towards something, maybe not quite so manual, but manual jobs today don't exist much. But so anyway, I think like a lot of kids, went in and started to look into medicine and stuff because it was sort of an idolized profession. After I got to it and stuff, I think I wanted to do it for a couple of different reasons and stuff. One was that. Two was I think I just wanted to prove I could because they kept telling me I wasn't smart enough. which by the way, don't let me tell you that, okay? You can make a lot of things, you don't have to be a genius, but you have to work. And so I wanted to prove I could, and I think that was one of the reasons I did it. And then once I started doing it, I started realizing and stuff, this is pretty cool. You can do a lot of things for a lot of people and help a lot of people in a lot of ways if you get good at this. So you heard Nick comment that my own training and stuff. I can tell you very briefly that I'm from Collinsville, Illinois. I grew up on a farm, rural, played sports in high school, same kind of most of you kids did and stuff. And I went to Eureka College, which by the way was the best decision I ever made in my life. Very good school and stuff, very proud of it and stuff, small school right down the road, has nice programs and stuff, but really a good teaching school stuff. I applied to medical school. I did not get into medical school the first time I applied. I got rejected. I went to graduate school. I went to the University of Missouri, which was another pretty good choice, and I got a master's degree in biochemistry. And then I reapplied to medical school and I got in. And I can tell you actually that my graduate advisor when I was in graduate school won the Borden Award in nutrition the year I was with him. He turned 65 years old. I was with him a year and a half ago, do the math, and he was turning 100. He could still walk up the steps by himself. Matter of fact, he could run up the damn steps by himself. And he's still doing research. He published a research article at the age of 95. He had to retire officially from the University of Missouri because it says so in the bylaws at the age of 75. So he couldn't take graduate students anymore and stuff, but he was still doing bench research at the age of 95 and publishing articles still because they let him come to work if he wanted to. Well, he wanted to, and he still wants to. And last I checked 3 months ago, he was still kicking. So I thought that was pretty cool. But anyway, so he was a big motivation to me. Now, he always wanted me, I talked to him 2 years ago, and he said, "What are you doing?" And I said, "I'm a doctor in a small town." And his eyes went down. He goes, "I always hoped you'd go back into research." He didn't want me to be a doctor, he really didn't. He wanted me to stay in research and stuff, but I couldn't see doing that my whole life because I got an allergy to rats too, so I wasn't doing too good. Then I went to med school, and I went to med school from 81 to 85, and I got my degree from the University of Illinois, and I went to residency in Kansas City the next day. And I did pediatrics at Children's Mercy, and I did internal medicine through Truman and the co-op, what they called in Kansas City at the time, and I came out, and then I got dual boarded. I was actually boarded in pediatrics first, and then internal medicine, and then geriatrics. And I carried 3 board certifications active for 20 years. And I just actually gave that up. I still do a lot of peds, but I don't take the peds boards anymore and stuff. I still have the internal medicine boards, geriatric boards active. You have to take them every 10 years. You have to be enrolled in a program called the Continuing Maintenance of Certification, MOC program. So you have to stay involved in it and stuff, and do your credits every year and stuff to stay board certified, and you have to take a test every 10 years. So mine's coming up this next year actually. So I'm going to do it again. Which is the only bad side about medicine. You always got to take some kind of test, okay? You always got to prove you know what you're doing and stuff. So, but it is. But I do find it's a good career. I still like it. Now you don't have to walk very far. I'm going to tell you that to find people who are disgruntled in medicine. Okay, they're disgruntled in medicine as your teachers are disgruntled in education, as everybody else is disgruntled about something. You can make a choice. You can whine and cry and piss and moan, or you can do your job, be good at it, and make something happen positive. Now, I've never been known for my lack of candor, lack of colorful vernacular, okay, or not having an opinion. All right, I've got all of those, but I do believe that, okay? You can make things happen positive, or you can whine and cry, which will accomplish absolutely nothing. No one's going to listen because they don't care. They've got their own problems to worry about, okay? So make your own happiness, make your own career, and you can do it in anything. I happen to be talking about medicine, but I know lots of people that do lots of different jobs. You know, I've got accountants and lawyers and maintenance guys that are doing just fine and stuff. The guy that fixes my computer, I think he's God because I can't do it and stuff, you know. So there's a lot of things, but you can make a career in anything you want, you like. And if you can like it, it's even better. Okay. But I do think medicine is still a rather special career. I do think that it holds a special spot because you have an intimacy with people that you don't get in many other jobs. Okay. You also know a lot of things you can't say about people because of it. But I do think that it is still a special career, and there's lots of things you can do in medicine. I mean, there's academic things, there's research things, there's direct patient care things. I don't know how detailed you want me to get, so I'll just try to phase out at that point and say, what can I tell you guys that you might want to know about careers in medicine? I thought you'd rather eat pizza, but that's okay.
After a long shift, what do you do personally to decompress if you've had a rough day on the job?
Drink heavily. I don't drink. I don't drink a case of beer a year. No, what do I do? I like I do all the things I tell my patients not to do. I veg on the couch. I love television. I like old westerns particularly and stuff. My father, God rest his soul, he passed away a couple years ago, and we used to come and visit. We would watch old westerns. That's something we had in common and stuff, so I like that. I walk, I bike. I used to play basketball quite avidly and stuff. I played in high school, played in college and stuff, and I played up till about the age of 57, I think it was, when someone more in your age group knocked me on my, and I broke this for the third time. It now has a screw in it. And I asked my hand surgeon then when I got done, I said, well, can I go back to playing? And he goes, well, yeah, you can play. And he said, but you can't land on that again. And I said, you know how this happened? He goes, yeah, you told me. I said, what do you think the odds are at my age I'm not going to land on that again? He goes, not very good. So I gave up play of basketball. So I took up yoga. I could do that. And I took up biking and stuff. So. But I'd say the commonest thing I do if I have a bad shift, as you said, I go and watch television.
Sure.
I like TV, but the other times I stay pretty active. I still work. I don't work near the hours I used to. Okay, I'll tell you, I'm 61 years old. I'll be 62 in a couple of months. I work I work at least 55 hours a week, but I don't work too many weeks anymore, over 60, 62, in that range. For about the first, at least 20 years of my career, I'm 30 plus now. Residency, medicine, and you've heard probably, I don't know if you guys heard, the Medicare studies they did years ago about residence hours and that type of stuff. That's me. I was in it. It was my age group. We did that. We were the people that proved you can't work 120 hours a week and do it well. Yeah, we did that. 4 years in medical school, I averaged 7.5 years worth of hours based upon a 40-hour work week. 4 years in residency, I averaged 9.5 years worth of hours based on a 40-hour work week. And for the next 22 or 3 years, I averaged about 72, 73 hours a week on the job. Okay, that is not counting on being on call or sitting at home. That is actually working. The call on top of that, I don't know. I didn't keep track of it and stuff. Now, I work about a 55-hour work week, but 5 days a week, 11 hours is about what I do. Some weekends on call, some nights. It probably goes just a little over 60 and stuff on average. But you can work less, you can work more. It's up to you. I mean, there's a lot of things you can do. You can book as much as you want to book, I guess. I was utterly amazed that if I book it, people would come. If you build it, they'll come. People actually come. I was kind of surprised at that. 8 o'clock at night, they still come for an appointment. You could have it and stuff. So I think a lot of people know what field you go into too. But I like television. I like walking. I like biking. I even like my wife most of the time. She's stuck at the airport right now, so I'm laughing. She texted me from Midway a while ago. Her flight got canceled. She's going to Florida. So she's sitting there. She'll take off right now, actually. So she was supposed to fly at 9:45 this morning. So I texted her and said, I hope you like the food at Midway. What else you got?
How'd you get into peds?
How'd I get into peds? Well, one, it's kind of funny. People know more about you than you know about you sometimes. I'm not exactly sure, but I think I always liked it, and I think I was always natural towards it. When I decided to do, when I got through medical school and decided what I wanted to do and stuff, I did what's called med peds residency. You do family practice, which contains everything. You do medicine and peds combined, which I do, which is 2 years of each one. I liked it. I liked kids. I knew that from the beginning. And interestingly, my mother, when I just told her what I was going to do, started laughing. She said, yeah, I figured that. And stuff, and so did a couple of my friends, my mother's friends, I should say, older people that I knew and stuff. So I think they realized what I was before I realized what I was. But I've always liked kids. I knew that from the beginning and stuff. But I also knew that I wanted a variety of different things, and I wasn't dead certain. So Med-Peds was a nice option for me because it allowed me dual boarding, 2 different fields to do, and the potential to specialize or sub-specialize in either one or both over time, okay, and stuff. But I think that the 2 fields that people realize right away when they go through their rotations in medical school, they either do or don't like. Number 1's peds. It's on top of the list. You either know you like kids or not, and the one's OB. Okay, most people realize that and stuff. The medicine, surgery, the surgical fields, sometimes people are a little, you gotta weigh them. It takes a while to make up your mind and stuff. But those 2 things, most people usually know pretty quickly. Now, the other thing you have to realize, and I always warn my younger peers about and stuff about pediatrics, is pediatrics is not a career of children. It is a career of parents. Okay? Children are easy, especially little ones. They don't go nowhere, they don't do much. You get to play with them, they're uppy, chubby, cooey, gooey, and they're fun and stuff. And even when they're running around the room like nuts, they're cute and stuff. Parents, on the other hand, are not. Okay? I put this thing on the board when I was giving a talk. I was at the hospital and stuff. This is years ago, 25, 30 years back, as I was at the hospital. And I said, what do you call, we call people who have children, and I write the first 3 letters, P-A-R, and what do you think everybody says? Parents. And then I complete the word A-N-O-I-D. Okay. With parenthood comes paranoia. I can tell you, I used to be a relatively intelligent man until I had children. I think I carried the kid in the house, put him in one basket, my brain plopped on the kitchen floor, and it's been there ever since, 20 some odd years later. It's just the way it goes. But yeah, you have to remember the peds is a field of parents or caretakers, and today it can be all kinds of families. I've got gay families, got mixed families, mixed racial families, ethnic families, foreign families. We've got people in the area here that come from Japan, China, Taiwan, Canada, that's almost another country. But you get the idea, stuff. But the one thing that they have in common is they will protect their children. All right? So if you go into pediatrics, you have to realize that you're going to deal with caretakers, parents mostly and stuff, but it can be grandparents. These days I got a lot of separated families, a lot of parents and stuff, a lot of grandparents raising their children and stuff. So, but I think I always knew that I liked kids, so that was an easy choice for me. Okay, going that way. And then the other things I just kind of added on to have potential.
What were your best studying techniques?
My best studying techniques, okay. Repetition for me, okay. I am an auditory learner, okay. I can read, and I can hear things once and remember them quite well. I can read them 3 times and go back and read them a 4th. Okay, so you have to know yourself, okay. So I can sit in class and pay attention. It makes an immense difference for me and stuff. Now that's not true of everybody. Some people are very visual learners. I'm visual in the sense of, well, like you guys today with the whiteboards and 3D things and all the things that are video. We didn't have that. We had a textbook. Okay, there's something written on a blackboard. Okay, it was 2D. So it wasn't too visual, but pictures do make a difference for me and stuff. But you have to know yourself. My biggest learning technique for myself was repetition. I just had to go over it and over it and over it. Medicine, now you have to realize, medicine in medical school, medicine's an applied science. Okay, applied science is in a lot of social sciences and stuff. It's not basic science. Okay, so when you're doing basic sciences, you're doing a lot of problem solving, a lot of problems and stuff like that. You had, these days would be computer and high-tech calculators and stuff. For me, it was a piece of paper, pencil, and I can go back to the slide rule, believe it or not. Honestly, when I was in high school, we were not allowed to use a calculator. Yeah, we had to use a slide rule. I did not use a calculator until I went to college. Okay, so I earned everybody's gray hairs. You see this mustache? I got them all for a reason. But we did. That's all we did. But for me, repetition is the biggest learning. Listening is a big learning factor and stuff. I like now, okay, in you guys' mode, the best learning techniques that I find here is to be able to do the equivalent of YouTube in an academic setting. Okay, you get to watch it. You get to watch it in 3D. Sometimes you get to get a lot of things put into it and stuff. It's very visual, and I think that for me now is a better learning technique and stuff. But when I was at your stage, it was just repetition over and over and over.
Knowing what you know now with all your years of experience, if you met your younger self in med school or even when you were getting your bachelor's at Eureka, what would be like a piece of advice that you
I'd say go back and throw hay bales. Now, I'd still give about the same advice I think I just gave you with a caveat. I still think in medicine or any career you're looking at and stuff, most careers are good careers if you make them such, okay? But you have to make them such. I mean, there's a lot of negatives to everything, okay? Because you can whine and cry about any field you want and stuff. But I would say that the one thing I didn't do, and you guys do have an opportunity because you're so young, I would get more involved in that field if I could and get more experience or at least exposure to the everyday realities of what it is. Medical school is not medical practice. In fact, it's not even close, okay? Neither is residency, really, although it's a little closer. But I think same thing can be said of a lot of fields and stuff, but it would be to see if you can get more involved in volunteering in it, interning in it, but getting more exposure to the realities of what you might take on, no matter what field it is. Because I think one of the things that I had, now some of this too, there's a lot of reasons and stuff. I can remember in an interview, interviewer asking me directly, why don't you have any volunteer hours in medicine? And I said, well, I grew up in the medical office, I volunteered here all the time by default and stuff, but I said, I really didn't have time. What do you mean you didn't have time? I said, I had to work. And he just looked at me like I was speaking Greek. Work. It's only got 4 letters in W-O-R-K, work. And he goes, well, I said, I had to work. I worked full time. And when I was in college, I went to school and I worked and stuff. In summers, I worked 60, 70, 80-hour work weeks. Many times I worked double shifts and stuff to have enough money to go to college. Same thing through between the 1 year I was in med school, I worked and stuff. He just looked at me and I'm thinking, like, what, were you born with a golden spoon in your mouth or what? And I said, no, I worked. I did not have time to go volunteer and do other things because I literally had to go. So it was a choice. Pay for it or don't get it, and stuff. But if you can get time in those offices, and if you're fortunate enough to maybe to be in a situation where you could get paid to work there or something, whether it be an office, a hospital, or whatever, and stuff, I think it's a good experience to get into the fields more and more. And that's how I think. Now, the college here does have a couple of things and stuff, but most of the colleges that we work with have mentorships and internships and stuff in their different fields. Now, medicine is not commonly a big one for most folks, but business and certainly management and stuff and other things and stuff. I know Eureka, I know they've got them with, the U of I's got them with a lot of different fields and stuff, but we got CAT, and stuff in Peoria. We used to go over there and stuff, and all the little, Emory's got them and stuff with all the IBM firms and stuff in their region and stuff. So get involved in those things so you can go see what really goes on, so you can get a feel for it. Because no matter what field it is, I guarantee you it's not the same thing in school.
What are some of the differences between what you do now and like a private practice setting?
Okay, well, now I'm employed by the hospital. I was in private practice for 23 years, okay? I started in Kansas City, and then I first practiced 5 or 6 years there, and then they sold us to the hospital as I was actually leaving, and that's when I moved here. And I was in private practice here for 17 years before I sold mine to the hospital and went to work for IBCH. In private practice, you have certain things. I mean, you are your own decision maker. You run the business on that end of it. You get to make your own decisions in regards to what you schedule, when you schedule, how you do things. That's all good to a certain extent. When you work for a hospital system, you do lose certain freedoms. I mean, you're going to have certain scheduling differences. You're going to have types of patients that they make you take or don't take, or that you're going to have to follow certain referral patterns and stuff that you may not do if you were independent. You might want to refer to X, they want you to refer to Y, etc. and stuff. So you do lose a few of the freedoms and stuff. You do have a little more backing in the sense of finance. You have a little bigger institution and stuff, so sometimes the pay can be a little better, benefits can be a little better. The biggest one for me being employed by the hospital system versus being independent. Actually, it was more money going into my retirement account. When you're your age, you don't think about that too much. When you got the white hair you see on my head and this mustache, you think about that a lot. And so it was a big deal for me to be able to have more money in my retirement account. But most of the rest of it, the types of patients you see, for the most part, the type of work you actually do is pretty much the same. It's just a matter of maybe how you do it, or what day you do it, and maybe they schedule it in shifts versus it's all the time, or you might work weekends or not, that kind of thing. So, but otherwise, there's not a whole lot of difference in what you're actually doing. So when you and I walk into a room and I close the door, that's my job. Whether I'm employed by them or whoever, the government or myself, that's still the same job.
When you required help from your professors when you were going through medical school and going through your graduate program, how did you approach them, and what approaches yielded the best results?
Okay, two very different situations. Three really. Let me start with college. Eureka's a small college. Okay, I knew my professors. My head of chemistry was the former dean of the University of Illinois Medical School.
So lucky.
Yeah, that helped. And stuff. But my biggest class at Eureka was 45 kids. My majors classes was 12 to 15. And so my last year and things like advanced P-Chem and physical biochemistry, stuff like that was 4, 6. It was easy. You knew your professors and stuff. This is a small school. After graduate school at the University of Missouri, the difference when you're in graduate school, you have a graduate advisor and a mentor. You're doing your graduate work and your thesis with somebody. Okay, so you have them pretty much automatically. All the other classes you take, you pretty much like any other college, you just have to go and ask. You have to know what their office hours are. You have to hit them up by these days. I'm sure you do it by email and stuff. We just had to literally go to the office door, leave the message on the thing, put it in the message slot, and I'm not kidding, and stuff, and wait for them to call you back. And you'd leave your office number, your graduate office number and stuff where you did your research and stuff, and you'd leave your home number or whatever. We didn't have cell phones and stuff, so we just do that, and then they call you back and you set up a meeting time. Most of them are pretty good. When you get to that level, it's not as hard as it is, say, at a level like this where you've got umpteen kids in a class, and stuff. So. But the biggest thing I found there, now medical school, good luck. Medical schools have changed a lot over the years. They've gotten much more student friendly, okay? I'm the tail end of the shut up, suck it up, get it done or get out era. I did not make up any of those terms. They were actually told to me, okay? Suck it up, buttercup, I don't want to hear it. Get it done or get out. And they would kick you out, okay? It was a tougher era. You were there to prove you could. They were there to prove you couldn't. And that's the type of competition system it was. So getting help in medical school was a little harder. The first couple of years in the basic sciences, you could go to, we'd always had extra study sessions with the students, with the professors would put them on sometimes too, if people were having trouble in classes or something like that, they'd do extra studies. They were pretty good about it. But once you got into your clinical years, it's very hard because you're working with various attendings on different services and stuff, and you really have to be at that point a very independent learner and stuff, or you will get buried. But most of the time it was just a matter of getting to that professor and asking. I found that the vast majority of my professors, barring a few what we call CPAs, certified practicing, they were pretty nice. They were decent guys and gals. They would help you if you asked. And, but the trick was to get there and to get their attention somehow. But most of the time, med school particularly, the first guys, you're pretty regimented in your classes. Everybody's in the same class together. Everybody's going through the same things together, the same labs together, etc. and stuff. So the professors and the assistance programs and the study sessions are kind of prefabbed for you, to be honest. So.
Okay. You mentioned getting that master's in biochemistry after getting rejected.
Mm-hmm.
And do you ever regret maybe sticking with research and pursuing that?
Sometimes I do. I think about it and stuff because research is interesting, and I would never deter anybody from it. I can tell you why I didn't want to stick with it, at the time I was doing it and stuff, which would have been the late 1970s, you know, it was a little different era. It's maybe even harder now. But a lot of research depends upon government grants, okay, academic grants and stuff. Sometimes you get in with, if you're doing more research with drug companies or private firms, that can be, you know, a little bit funded, but you're also a little more restricted. You're doing what they want you to do and stuff. I knew that I didn't want to do that for the next 40 years of my life, just living and depending upon a government grant as to whether I had research to do. And it's a bit of a publish or perish type of mentality at that time and stuff. If you weren't publishing articles, you weren't staying very long. You get a year or two and then go find a new job if you can't publish something. So I didn't want to do that. So for me, medicine was also a more secure field in the sense of a job. And if you don't believe me, I'll ask you the following question. You ever seen an unemployed doctor? Not many. Okay, and stuff. So that's what they did. Dr. Gard told me that one time years ago. So he said, "What are your kids going to do?" And I said, "I don't know." He said, "They like medicine." I said, "No, actually, neither one of them. My boys both hate medicine, to tell you God's honest truth. They don't have nothing to do with it." And I said, "Why?" He goes, "Well, I talked to him again." I said, "Why?" He said, "You ever seen an unemployed doctor?" You don't. There are not many unemployed doctors. So it's in that sense, it's relatively secure. And I wanted that too, because I'm not that cocky. I make jokes, but I really runs pretty scared when it comes down to having a job. And so.
For those going on to medical school, can you address how they should finance it or afford it?
Okay.
Like have to again?
Yeah, I can tell you a real brief change on that over the years. I was very lucky going to medical school. I got a General Assembly scholarship for a couple of years that saved on tuition, which at the University of Illinois at that time was a whopping $12,000, okay? It cost more than that per semester, just about every school I know of today. I came out of medical school, $35,000 in debt, paid it off in 5 years. Most everybody I know coming out today are a minimum of 6 figures. I have a cohort that I work with regularly, and she is $200,000 in debt, which is more than my house loan, or my house mortgage was when I bought it, but not unusual. I don't know the best ways to finance it today. You would have almost as securely, even if daddy's a doctor, have to secure loans to go to medical school. I don't know anybody who's not. Okay, well, I shouldn't say that. I do know a couple of people that are not. But daddy's quite well-to-do, okay? And if daddy and mommy have that kind of money, you consider yourself fortunate, kiss their ring, say thank you, and move on. But most people don't have it. So I would have a couple of words of advice. One, particularly at the level you are now, you went through your, an associate's degree and then a bachelor's degree. Do not incur debt, okay? Don't do it. You don't need a new car. You want one, but you don't need one, okay? You don't need, a Patagonia coat. You get it? Okay. Sorry, I didn't see it. I really didn't. I just threw it out there because my son has one too. Okay. But don't incur debt. All right. You pay for debt. Now you're a little better off than I was. When I went to medical school, the cheapest loan you can get was the guaranteed student loan. You could take out a max of $5,000 per year. You didn't pay for a lot and stuff, but up to 20 grand for the 4 years. It was at 9%. HEAL loans, health professions loans were the next thing that most people got. They were at 11 point something percent. HEAL loans were health education and something or another, I forget what it stood for. 19%. They were basically credit cards, okay, when I was in school. Now, that is also coming off of the, what we call the Carter era and stuff, the 70s and stuff. You could get 10%, and I did, on a CD in the bank, because inflation was that high, okay? My bank called me when I forgot how old, and said, "We need to move this money." And I said, "Well, I don't want to move that money. That's like $5,000 and it's getting 10% or 9.8%. That's why we need to move it." I said, "No, we don't. You want to move it, but I don't want to move it." And I let that CD sit for 2 more years until it matured and they refused to renew it. okay, and stuff. But you could make a lot of money at that time because inflation was so high. Of course, inflation was running 8, 9, 10%, so you know what you bought this year cost you that much more next year. But don't incur debt. Try to do things as debt-free, particularly at this level and your bachelor's level, as possible. Then when you do incur loans, or try to look for scholarships, look for other aid mechanisms. There are some out there. There are some governmental programs and stuff that you can get into and stuff, but you really got to search to find them. And then when you do secure the loans, secure them from whatever institution you can where you can get the best interest rate, and secure them incrementally. Do not take a lump sum at the beginning. Do the arithmetic on what you pay back on 50 grand taken here versus 15 grand taken 3 or 4 times. Okay? The amount of interest coming in that last year on that big loan is significant. Okay? So I advise all my students, don't do that. Don't buy cars off your loan money. Don't rent fancy apartments. You can get them in thinking that you can pay them off later. If you look at your average interest rate and stuff right now, I think you guys can still get between 5 and 7. But if you do the math on that, on how long it takes to pay back, a lot of the residents coming out now are amortizing their med student loans over 20 and 30 years now. Ours were set at 10, and you had to pay it back in 10 years. It was a 10-year, that's it, type of thing, and which was actually good, because it kept you from incurring long-term debt. Okay, long-term debt is a noose around your neck, guys. I'm telling you. Until you sit down and put the numbers on paper, do it. I advise you strongly to do it, to look at it, because it really will hamper you. I've got a couple of friends that I work with, who are much younger than I am. Stuff. They're a little older than you guys. They're only just out of residency. They're all in their early 30s, and but they're coming out with $100 and something to $200 some thousand in debt. They're paying interest on that over the next 20 to 30 years. They want to buy a house. There's another couple $100,000, and then the interest on that in debt. They got to pay for a car payment. They've got a kid or two, and they want to try to save for college. You got to make a lot of money to do that. Okay, so that's one of the downsides. And the other downside is, when you come out and people come ask me the other day, one guy asked me, "Are you going to retire?" I said, "No." He said, "Don't you want to retire?" I said, "Sure, I'd love to retire. I'd love to go boating. I'd love to go fishing. I'd like to go visit my mother." And he said, "Well, why don't you retire?" I said, "I can't afford it." And he looked at me like I was nuts. And I said, "You got to realize, yes, I'm a doctor. Yes, I make more money than most people do. Okay? Do I make 6 figures? Yes, I make plus 6 figures. Okay? If you got a physician making less than 6 figures, go to somebody else." Okay. Right. So, but when you start figuring, I did not get my first job until I was over 32 years old. I came out $35,000 in debt, which at that time was fairly significant. Had to pay that off over 5 years. Now I'm 37, 38. So I don't start saving a penny until I can get into the next year or two's worth of work. I don't have a retirement plan until I'm 40 years old. Okay? Takes a little while. Now granted, there are certain fields. Now I chose primary care. Don't do that. Okay. I strongly urge anybody who wants into medicine today to specialize. Okay, it's a better career. You're safer. They won't replace you quite as easily. Things like that and stuff. And I do think that medicine's getting to be a very, very complicated issue. So I strongly advise most people today to specialize. But if you ever do want to retire, it will give you an income level that is significantly greater than what I can generate. Okay, so I will work conservatively till I'm 70 years old before I can retire.
Speaking of specializations, what would you recommend as a field, or what would you do
If I were to do it again?
Yes.
If I were to do it again, I would be in surgical specialty. Okay, I love surgery. I love procedural things. I did procedural things like even in my practice as an internist until the last couple of years, where they kind of phasing them into the specialists only and stuff, because I like mechanical things and stuff. And I will tell you candidly, one of the reasons I did, and this was a mistake on my part, I let the way I was treated in medical school affect my decision making as to what I wanted to do in residency and for a career. Don't do that. That's why I say if you can get into some of these things or go look at some things and stuff and see what the reality of that field is in the real world versus what it is in the training world, I think you can do it, because I happened to go to a school where the surgery program was quite strong, very good and stuff, but if you ever wanted to see the traditional treat the students like program, I went through it. We were human fodder to be stepped on, and we were, okay? It's not that way too much anymore, but I let the way I was treated at that time affect my decision-making and stuff. And if you want a nice guy feel, it's definitely peds. Pediatricians are nice people. They're easy to work with, they're nice guys and gals, they're more fun and stuff, but some of the surgical fields spread itself into really being big jerks. But I let that happen, and that is a mistake on my part. Okay, so I would advise you don't let that happen just because you get a bad professor here, or you get a bad teacher there, or the way something's going